Good morning everyone, myself Dr. Nisha Malik, Assistant Professor from Department of Physiotherapy, RPIIT Karnal. Welcome to our YouTube channel which is RPIIT Academics. So further continuation of spina bifida. In this clinical manifestations, signs and symptoms vary according to degree of spinal defect. Readily apparent on inspection, loss of sensation below lesion, poor urinary and bladder control, joint deformities in lower extremities, scoliosis or kyphosis, then hip dislocations, and diagnostic evaluation, examination of meningeal sac and clinical manifestations, MRI, CT to access condition of brain and spinal cord. Other defects may be present. Prenatal fetal ultrasound or amniotic fluid sample for alpha fetal protein AFP. Test should be done between 16 and 18 week of gestation. Afterwards, AFP level drops, making detection of spina bifida difficult. Also, therapeutic abortion not option after this time. Therapeutic management, multidisciplinary approach. Neurology, neurosurgery, pediatrics, urology, orthopedics, rehabilitation, PT, OT, social services, intensive nursing in many areas. Goals: prevent infection, early closure of lesion within 72 hours, prevent infection and trauma to exposed tissues, and prevent further motor impairment. Goal is satisfactory: skin coverage of lesion, PT for specific deformity, physical therapy to prevent joint contracture, correct deformity, prevent skin breakdown, obtain best ambulatory functioning. Then management of genitourinary function. Myelomeningocele is a common cause of neurogenic bladder which lead to urinary system distresses. Then urinary incontinence is common. Clean intermittent catheterization as a conservative treatment. Vesicotomy, that means anterior wall of bladder, both the abdominal wall to create stoma, may be done for bladder control. Meticulous skin care is needed. The nursing care. In preoperative positioning to keep off sac, use diaper, rolls, pad or sandbags. Keep in prone position. Can be challenging. More difficult to keep clean. Pressure areas a threat. Feeding a problem. Postoperative. Prone position until healing take place. May allow sideline depend on doctors. Feeding resumed after anesthesia wears off. Comfort, measure, vital sign, I and O, input and output. Then latex allergy. 70% of children and adolescents with SV are sensitive to latex. Use unknown, probably continued exposure to latex. Avoid latex, balloon, condoms, catheters or anything with latex. Then post-operative. Use touch for stimulation since can't hold. Observe for increased ICP such as bulging frontalis. Access for infection. Increased or decreased temperature, irritability, initial rigidity.